I'm Fred Pilkington. I started at Cabarrus Health Alliance, then the Cabarrus County Health Department in 1981. I got a Bachelor's of Arts in Political Science at UNC Charlotte, a Master's of Public Affairs at NC State University, a Master's of Public Administration at University of Southern California, a Doctor of Public Administration at the University of Southern California, and a Master of Arts in Homeland Security at the Naval Postgraduate School. The people. In 1981, people were less willing to accept public health, more argumentative, I guess is the word. We used to have major battles over septic tanks. We used to have major long 3-hour meetings at the Board of Health fighting over issues mostly related to environmental health and communicable disease and other issues, home health and all the things we did in those days. Today people are less confrontational, I guess is the word. I think the next 5 years will be really difficult for public health. The President's budget has major eliminations of public health preventive funding. That's always been an issue that's kind of on the chopping block. Public health has been seeing reduced funding since 1986, and it's continued to go down almost every year since then. There's been no new money into public health other than what came in after 9/11, and that was short-lived. As soon as everybody forgot about 9/11, then that money dried up, so we don't have any bioterrorism money anymore. So we're back to square one. Counties that are involved in public health have to be more creative in the way they find funding and resources to do public health. This county's been fortunate in that we've done that. We've always been able to look at new revenue sources, whether it be grants, whether it be other ways of going about it. We have a Board of County Commissioners who are very farsighted in the fact that they've funded school nurses for every school in the entire county, which is unusual in this state and unusual in the nation. Mecklenburg County, for example, beside us, has nowhere close to the number of school nurses we have. So there's a lot of challenges out there. Probably the biggest challenge is the obesity epidemic and what it's going to create for us as we move forward, and of course the opioid epidemic. Those two things were not something we anticipated being as dramatic as they have been, nor as deadly as they have been. A lot of the things that are killing us are very nutrition related and mostly associated with the size that we've become, and it makes it really a challenge for public health, because what we have to do is work on people changing lifestyles, changing eating habits, and all those things do not come easily. Well, a lot of things make us different. Interestingly enough, we're called Cabarrus Health Alliance. We're the only health department that I know of in the nation that doesn't say public health in their name, or health department in the name, one of the two. But we're legally a hospital authority. That's how we began. But we do no hospital care, which is a bit strange. We also are a public authority under the Public Health Authority Act. We're also a not-for-profit. We're also a private corporation. So we can act as a business if we need to, or we can act as a not-for-profit if we need to, or a governmental unit. And those things make us really unique and different. Makes it easier to work with our partners on the research campus and with other partners. Makes it easy even to do things in working with other health departments, because we don't constantly have to go before our Board of Commissioners and ask for permission to do this or permission to do that. Most people do not realize that we're not part of the county. We're not a department of county government. We are an entity unto ourselves, and because of that we rely to a great extent on our own ability to raise funds to support ourselves. In any kind of outbreak, the primary role of the health department is to take care of that outbreak and bring it to a close as fast as possible. With hepatitis A, you have a certain number of days to inoculate the people that could possibly be affected to keep them from contracting hepatitis A. Unfortunately for us, this whole circumstance revolved around the worst timing possible. On a Super Bowl Sunday, a food or a vegetable he went through vegetables and cleaned out all the bad vegetables with his bare hands each day. So he was the one with hepatitis A. That means he touched almost every vegetable in the entire grocery store. He was also instrumental in helping make all the trays that went out for Super Bowl Sunday. So between those two things, we had about 2,500 people who could possibly have contracted hepatitis A from that. That Sunday after Super Bowl, I guess it was Thursday evening, we found out that this particular individual had hepatitis A from the hospital. He had been there for being ill, and when they asked the list of questions they asked, he volunteered that he worked at a local grocery store. And when they found that out, they immediately called us and told us what was going on. This was probably about 4 o'clock on a Thursday afternoon. We knew that we had the weekend to get all this done based on the dates and around when we had to administer the vaccine. And we had a predicted ice storm the next day. Well, the ice storm actually started that night, and it was not a small ice storm, it was a huge ice storm. And we couldn't get the vaccine in, so we actually called Food Line, which was the company involved at this time, and told them we were not able to get the vaccine in because of the ice storm. Could they fly their private corporate jet to Michigan and pick it up? Which they did. They flew the corporate jet to Michigan, picked up the vaccine for us. Being a good community partner, we appreciated that. Brought it back to us. We opened up the next morning thinking we probably would have nobody for a vaccination, and before we even opened the doors at 8 o'clock, there were people filling the parking lots already. One thing you have to remember about hepatitis A vaccine is it has to be administered in the buttocks. So that means everybody takes a little longer to get it because you have to somewhat disrobe. So it is a bit of a more laborious process. We started that morning. We worked literally around the clock until Saturday night without a break. 1,800 vaccinations were given during that time, and not a single person contracted hepatitis A. I think it's important that a group like Leadership Cabarrus understand the bioterrorism role. Most people don't, they think of fire and rescue, police involved in a situation like that, but if there were a bioterrorism incident, we are the lead agency for that. Bioterrorism being smallpox, for example. If smallpox were introduced back into our population, we have 72 hours to inoculate the entire population, or 50% of the people will die. So that's a pretty difficult task considering we have 200,000 people and we've got to give out 200,000 vaccinations in 72 hours with a staff of 200. Run those numbers and they don't make sense in any way you run them. The good thing is we have plans and contingency plans in place with everybody who can possibly legally give a shot, including veterinarians and pharmacists, so that all those people are on call and can be brought in at the last moment. We have places in place already that we can bring people, park their cars, transport them, and all those things so that we can give the appropriate vaccinations. And in addition to that, we have that for almost every bioterrorism agent that might possibly, the plague or anything else, impact on people. So we've got that responsibility that hopefully never happens to us, but it's just a good thing for everyone in the citizenry to know that plans are in place. We feel real confident about our ability to take care of it. We drill these occasionally. Just had a drill last year showing that we could do this. We actually brought in the Strategic National Stockpile from CDC a few years ago and did a large-scale inoculation exercise at the Cabarrus Arena, again demonstrating we could get it safely from Charlotte Airport, get it here under police guard, which will have to be on those cases, and we're able to get it done and get all the number of simulated vaccinations we would have had to give in that day done. So that's important. I think the other thing that people really don't understand is most people begin with the idea that I don't know what public health is. It never bothers me, affects me. I don't touch public health. And I always first off ask them, how many restaurants have you eaten in this week? And almost every hand goes up in the room. Well, that's because we inspect all your restaurants, so we touch you every day with just that. Water supplies, septic tanks in this community, sewage, all those things fall under our purview. So when it comes to your safety and your health on a day-to-day basis, whether it be the environmental aspect of it or a kid in your class with lice or tuberculosis, we're the people who get involved in that and make sure that your child does not end up sick because of that. And again, part of that comes from having a school nurse in every school.